Hello everyone, present here virtually. I am Preeti here. I welcome you all for today's 5-day workshop, which is titled as Photography in Dentistry and Application of Macro Photography. And today is second day of workshop. And today topic is Light and Lighting System. And presenting this session, we have with us our today's expert, Dr. Hiroj Bagde sir. Dr. Hiroj Bagde sir has completed his master in dental surgery, Department of Periodontology in the year 2014. He has completed his MBA in hospital management and clinical research from Symbiosis University, India. He has completed PhD in dental science in year 2018. He is currently a faculty as an associate professor in Estimated Dental College. He is a recipient of honorary best academician, best dental photographer, and best tutor Asian Pacific region in various awards. He is currently engaged in growth factor and it used by study on plated bridge fiber. Without wasting much time, I am welcome to Dr. Hiroj Bagde sir. You may start now, sir.
Thank you very much, Research Circle again, and thank you very much, Preeti, for the brief introduction. So I welcome you all again for the second day of the workshop which is being conducted. Now, yesterday we had dealt with the whole of the camera systems, the cameras, the lenses which are being used for dental macro photography. Now today we'll go a step ahead. So need not to worry about the difficulties which we are going to face today, but it will be very much simplified and understood by each and everyone. So I have made my presentation in such a fashion that everyone can understand it very easily. So for today, we will go and start off with the previous version of the slide which I had given yesterday. I'll just take you to the slide. Yeah. This is the slide which we had yesterday seen it. The slide was about the settings which are going to be seen inside the camera whenever we start off with the clicking of the images. Now, can you see this? This is a dial which shows, yesterday I have already discussed about it, I'll again revise it. This dial tells us about the shutter speed. This dial tells us about the aperture size or f-stop number. This is called as f-stop number or the aperture size. And this is ISO. ISO is the light sensitivity for the camera itself. Means, I will just again revise. If the shutter speed is at 2, means it's 2 seconds. And as it goes in fractions, it is fraction of the second which is being measured. Then we have something called as the ISO sensitivity. Now ISO sensitivity is such a term where the smallest number means that we are having a sensitivity to light at the minimum levels, and as we go ahead to 5600, we will have an sensitivity to light at a very higher level. Means we will be working on with very low lights in the sensitivity, means that the camera should be at a higher sensitivity towards light. So that as the number increases, the sensitivity towards light also increases. Fine. Now again, I welcome you all again. We'll go back to the today's slides. Now, whatever 3 things which I had mentioned, these 3 things are called as the exposure triangle. Now, just I'll tell you in brief what we are going to study today. We need to have something called as the exposure triangle to be balanced. You can see this exposure triangle. I'll just explain. Now, sir, first of all, first parameter, it is called as the shutter speed. Can you see this triangle in purple? Okay. Now we have markings here. Can you see the markings? 1 by 2, 1 by 4, 1 by 8, 1 by 45, 1 by 60, 1 by 30, 1 by 60, 125, 1 by 250. Now this is the fraction of the second for fraction of the second time for which the shutter remains open. Okay. So I have written 2 things above it. Can you see? More blur, less blur. Means if you have a shutter speed at half of a second, means that the light will pass for half a second, and your hand should be even stable, you should be stable, or your camera should be mounted on a stand to get less blurs. But in dental photography or in macro photography, our shutter speeds are at a very faster rates, which leads to less blur. Now I mentioned the mode dial which we had yesterday talked about. And you see the MASP, this was programmed auto, this was shutter speed priority, this was aperture priority, and the last one was manual. Every photograph in dental photography or it be macro photography has to be in manual mode. It has to be in manual mode. There are no modes to be used other than manual mode. We are going to manipulate our settings so that we get the same exposure, same kind of image every time we click in a dental photography or in macro photography for that sense. So we are going to have less blurs. We need less blurs because we need to have some good quality images. We need to have detailing of the images. So we will go for this kinds of shutter speeds which are dealing with 1 by 125 of a second and 1 by 250 of a second. So our shutter speed will not be in this range, it will be in the ranges of very small fractions. So means that the shutter will open and close in very small duration of time. So our shutter speed will give us less blur, and because of this less blur, our images will be having good details. Okay. Now second one was the f-stop number, which I had just told you about. F-stop denotes the aperture opening, how much the aperture should open, or how much small the opening should be, or how much large the opening should be for the light to enter and for the image to be captured. Okay, now I'll just shift over here. Now you can just see the f-stop number. There are changes from 1.4 to 2.8, 4, 5.6, 8, 11, 16, and so on. So we are having more than 16, we are 32, we can go to 50, 52. Depends on the lens which we are using. Now our lenses which we had talked about for the macro lenses, we are having a shutter aperture of 2 max 52, 56 also. So as we go up in the number, as we go up in the number means from 1.4 to 16, 32, 56, like that, the aperture goes on decreasing, means less light will enter. Simple, it's very simple. As we have a larger aperture size, means here f1.4 will be having a very big aperture size, and f22 or f16 will have a very small aperture size. Why we are going to play with this is because we need to have very limited lights, because we are going to give lights. Next session, next slides, will learn about what the flash system does. Flash system gives you an external light source which is not related to the external background or the environment which we are working. It gives you an external light source from outside. We are giving it through the outshow, or we are buying the flash systems, and when we are attaching to the camera, and it will give you light. That light is used to capture the image. So we are not bothered about the light which is present in the surroundings. That's why the flash and the flash systems are the priority or the main base of what macro photography as well as dental art photography is talking about. So as we go on increasing the aperture number f16, so we'll have a smaller aperture size. It is just inverse relationship. Now f16 will have a very small size, means very little amount of light will enter. And if we are having this fraction of a second, means we will have less blur. And just below this, you can read here, it is less in focus, more in focus, which means if we increase more the f number, more amount of area will be in focus. I'll just give in the next slide, I will tell you how it is correlated with our details and of the image. We want everything to be in focus, or we want a very small area to be in focus. So you might have seen many portraits, the background is blurred, and we have the person who is standing in front of you at a very sharp image. So in that case, the f-stop number will be in the lesser ranges because we have very less area in focus. Whereas in dental art or macro photography, we can try these versions also, but we want more area to be focused. See, because if I start on clicking for the anterior area, if I focus it on the lateral incisors, and I want the whole of the anteriors with the premolars or the molars also. So I will just go on increasing my f-stop number, and I will not go for these values. If I go on increasing the f-stop, more amount of area will be in focus, and then after focusing, we will have a very sharp image till the molars. So our area of concern depends. So, suppose if I want to just click the central incisor, so my f-stop number in between 2 and 8 it will be, because see, I need to have a variant of only the central incisors to be in focus. So my thing is I have to manipulate according to the area which is being. Suppose if I am going to take a image of a person who is just like a portrait or who's sitting in front of you, so I want him only in focus, so my f-stop numbers will be at a lower range. But if I want to go on for intraoral photography and I want to take details of each and every tooth, so my more focus area I will need, and my aperture size will go on increasing. So f-stop number will be increasing. Now, the third portion in the light blue color is the ISO, or called as the sensitivity of the light for the camera. The light falls on a sensor which is there inside the camera, and then that sensor gives you an image, and that image is being seen inside your eyepiece. Now what we are going to deal is the light sensitivity. Why you need this? Because we are having two things to be working, because we are going to give some flashes to it, so it will be very bright light inside. So I don't want the object to be looking like a very bright image. I want everything to be stabilized. I want to have the colors same as what are there inside the subject. So what I will do is I will just manipulate with the ISO also. Now I will have to manipulate with shutter speed. I will have to manipulate with the aperture. So also I need to manipulate with the ISO settings. I will tell you why. Because there are two things here written. Can you see? Less noise, more noise. What does this noise tell us? Noise is just, in layman term, I will tell you what does the meaning of noise means. The more amount of grainy image, just to make you understand very simply, is that noise is equal to grains. It's not exactly equal to grains, but I want very less amount of grains, a very detailed image. So I want a less noise inside the image. Okay, so whenever I click for a dental art or macro photography, I want everything to be very detailed and very precise to be taken at a particular. Suppose if I am focusing on a molar, so I want everything of the details of the molars to be coming out, whether it be the ridges, or if I am clicking an insect, so I want the details of the insect also, of its surface of the skin, or whatever we are focusing on. So my image should be having less noise. So my settings for ISO will be in this range of 50, 100 and to max 200. But for more noise, can you see this? If I go on increasing the shutter speed, ISO settings from 1600, 3200, 6400, this will give you more amount of noise, means a very sharp image will not be there. But this type of settings are utilized for night photography, where the light is very minimal and we want to capture as much as light as possible by increasing the ISO settings. But as we go higher in the ISO, we will have more amount of noise, more amount of grain, so detailing of the images is lost. So we have to make a balance in between these three. That's why it is called as the exposure triangle principle, and it has to be very perfectly denoted whenever we are going to take any kind of picture. Okay, so I guess so people have understood this. We will just look after a few pictures here. Okay, you just go through the four pictures which I have mentioned here. Can you see the first image? As I have told, f is 2.8, means a smaller number. So you just click, recall again, f smaller number means there will be large aperture size, and if there is large aperture size, less amount of area is focused. Can you see everything here is blurred, just a thin line in between is focused. As I go on decreasing the size of the aperture, f5.6, you'll see the aperture size is small, f8 again small, f11 again small. So as I go on increasing, the sharpness of the image is very good. Can you see that there was a blur in the tires also, you can see in the lights also you can see, but now you can see a very clear image here. So this means I have to have a f-stop number at an higher range whenever I am going to carry out macro photography or dental art photography. For that sense, I have to have an f-stop number at a higher range. Now, all those who are attending or all those who will be seeing it on YouTube again, please make a note of this whole image. This has been constructed and studied a lot, and I have collaborated everything inside this about the types of images which are there for dental imagery, and these images are to be required whenever you are carrying out a case. So whether it be pre-operative or post-operative, we are going to have magnification, we are going to have aperture, we are going to have shutter speed, point of focus, cheek retractors to be used or not, reflected image to be there by use of mirrors or not, horizontal, and where the horizontal midline of the photo is there and where the vertical midline of the photo is there. That means I am going to discuss about these parameters, because see, whenever you click a image, whether it be a portrait of a person, whether it be pre-operative image of a person, just like we need to have a profile of the image, a profile of the person. So I will have a full space smiling, I will have a profile full smile. So I will have this utilization where the magnification ratio is 1:10. So what does this mean, magnification ratio? There is a very good system built inside the lens which we had yesterday talked about. This lens is the only lens where we can manipulate with the magnification ratios. We cannot manipulate it inside mobiles. We cannot manipulate it inside any other type of lenses which are there in DSLR except for macro photography or macro lenses, which I had told you yesterday. Now we are having 1:10 magnification ratio, means when we open the ring of the or focus ring of the lens, we can manipulate the magnification. We can go to 1:1, which I had yesterday told. 1:1 means the same exact size of the image again reproduced back inside your own camera. Again 1:10 means the ratio and the magnification and the amount of means the person size and the magnification ratio which is being reproduced inside the camera is 1:10. Full smile 1:2, means everywhere we are going to have different kinds of magnification ratios. We are going to have different kinds of aperture. See now, full face smiling, which I had just now explained, f5 to 6, 5.6 to 8 means it is in between what is called as very less focus and or blur to a more focused area. So as I go below, it will be, see, it is going from f22 to 29, means we are going to have area to be at a very more focused area for the apertures. Shutter speed did not to manipulate more for all kinds of dental and macro photography. 1:25, 1/125 of a second to 1/60 of a second. Max can be gone to 1/200 of a second. That much is enough for us. So there is no manipulation as such in shutter speeds. Whenever we are talking about macro or dental, I'm talking about dental first, then we'll talk about macros. Macros can be manipulated anyhow because we are going to work in manual modes. Then comes the point of focus. Very important point. Whenever we are taking full smiling image, full face smiling of the eye should be in focus. So whenever we have a camera inside, we have something called as focus points there. So our focus, the focus point has to be fixed in the eyes of the patient, so that the area which is just bilaterally away from the eyes will be in focus by use of these settings. Okay, so if I am having something called as right buccal, so I am having canines or premolars. In between the points of the canines and premolars, I will have a focus point, and then after that I can just go for a click, and I will be having use of very good exposure triangle principle. Again, I will have a good clear image over there. Next is for the cheek retractors. Cheek retractors, where to use or not to use. Cheek retractors are those which help us to just retract the cheeks away, so that the light goes and hits every part of the oral cavity inside. Next is about the reflected image. I have just yesterday explained about the light which has to be light will fall, and my image will be a reflected image, just like a mirror. So I will put a mirror inside the oral cavity. I just explained on the last day about how we are supposed to sit, how we are supposed to place our patient, how we are supposed to angulate our cheek retractors, how we are supposed to angulate your mirrors inside, so that you get a very clear image. And I will share you some images of mine also, so that it is very easy for you to understand. And after that, we are having horizontal midline and we are having a vertical midline. So horizontal midline, what does it mean? Horizontal plane, and in that we have to set a midline in the horizontal plane, and in the vertical we have to set a vertical midline. So patient's nose, if I have written on occlusal plane, and if it is written as patient's nose, so patient nose will be in the midline of the horizontal plane, and your profile, whenever you are clicking a profile. So when I sit the patient in front of me and make the patient sit in front of me, then the patient's nose will be eyebrows will be in the focus, and the nose will be in the horizontal plane. So it is to be always fixed whenever you are carrying out this kind of intraoral photography or extraoral photography. Okay, now it's very simple. We'll go on for the flash and the flash system. Just go through these images. Just wrote about two flash systems which we had yesterday talked about. That is called as twin flash system. We can utilize one single flash also, not an issue. We can utilize the ring flash which I had yesterday explained. We can have two flashes to be kept at an angulation of 45 degrees when we are having a click inside or outside of the oral cavity. Simple. Now whenever we angulate it, after that we have two lights. So we will have two lights. First light is called as the key light, and the second light is called as the fill light. Why we need this? We can manipulate with this regarding the profiles or the facial profiles of the patient whenever we click the facial profiles of the patient. So we are not talking about intraoral. Okay, this is an extraoral photography. When you see the image, there is a big fill light and there is a key light, full power and 1/4 power. Second is having full power this side and half power. So as we go on increasing the powers or the ratio, this is called the power ratio. One light is at the full, means it is 1, and this is 1/4, means the ratio is 1:4. Then this is 1:2. The next image will be having 1:1, where the whole of the face of the patient is illuminated, where we want this facial profile to be very much visible. So I'll go for fill is to fill. This key light is also full power and fill light is also full power. So whenever I'm using twin light system, I can manipulate in between these two. See, this depends on what kind of photography you are carrying out. Suppose if it's a portrait of a person, it's not regarding any kind of dental photography, just a portrait, we can manipulate with all these three kind of settings. We can have a full power, we can have a 1/4 power, we can have a half power. This will give an artistic image, these two, but this will give you what is required for a dental profile. So same principle has to be applied inside the oral cavity. Whenever we are inside the oral cavity, the whole of this oral cavity should be illuminated in such a way that the light goes and hits each and every corner of the oral cavity, and that's why both the light should always be in full power. If we don't have full power, then the light again will give shadows, as shown in this image. It will have something called a shadow in one area, and one area will be totally illuminated. So I prefer to have it full power on both the flashes. Now, yesterday I told you about this kind of flash system, R1C1. I am having this R1C1 system. Can you see this? We are having three components inside it, two flashes and one commander. Now, what does this flash system, how does it work? It is very simple, very simple. This is one ring where the adapter, it is a ring adapter on which the two flashes are applied. These are just individual flashes. Now they are having some power settings inside, is on and off button. So we will have the same settings which I had yesterday, this time the last slide told you. We will have the settings to be manipulated in this way. So I can change the power to half, I can change the power to 1/4, I can change to 1/8, I can completely turn it into full power. So the power can be changed in these two flashes, 1 and 2. And there are many other, nowadays many other systems which are having multiple flashes. We can arrange up to 6 or 8. So this flash system on the ring, it can be adapted, and we can get a circular light, so which was called as a ring flash. So ring flash is nothing plus a flash which is having a rings type of a structure. It is not like a twin flash where the two flashes or systems are apart from each other, and these two both can be connected to this commander. This is a wireless system. See, there is no wire here. Yesterday I had a question about ring flash to be having a wireless system or not. Till now it's not there, but definitely a twin flash system is having a wireless system. Need not to worry about, just you need to charge this, you need to charge both the batteries of this, and we are ready to go. We can just place this commander over the hot shoe, which I had yesterday explained, hot shoe, and we can just go and click the patient's photographs. So now what this flash system works on, I've just mentioned one word here. It's called as TTL. We'll talk about TTL first. I've just written what the TTL stands for. Okay, just see, this is the commander, this is the shoe plate on which the commander is going to fix on the hot shoe of the camera, and this is called as the TTL, through the lens mode. Means that a camera will measure the output of the external flash. Just first read it first. The camera will measure the output of the external flash and stop the flash once illumination is sufficient. Means it is very important. I don't want extra lights. I don't want extra lights inside whenever I am carrying out my dental art photography. In this case, the TTL mode through the lens mode is very much important. This mode can be changed here. So I can change to TTL, from TTL to non-TTL, and this is an on-off button over there. I am having different channels. Can you see A, B, C? So I can have connection of 3 here. So this means that A is one flash system, one flash on the right hand side, B is the one flash on the left hand side, and we can add one more flash here. So it is having 3 flash systems which can be attached to this, so that the Nikon R1C1 will have this system, and we can directly attach this flash wirelessly with the help of the system inside the commander itself, and we are ready to go. Now see, there is one red button which tells us about whether the flashes are ready. Now why this red button is there? It tells us ready. Ready means that the flash system is ready to flash, to give light. But after some time, once you click, then the flash is fired, and after the flash is fired, it waits for some time for again the flashes to resettle back, again the flashes to fire back. So there is a recycling time, that is called as a recycling time for each and every flash system. Some flashes are having very limited of 1 to 2 seconds, some are having 3 to 4 seconds. So we are having different kinds of flash system, and after that we are having something called as a flash, this arrow, orange color. Now what is this? This is a testing button, whether your flashes are working or in sync with each other or not. So we have to test it on both the aspects, where this orange colored button, when clicked, we can have both the flashes to be tested. before utilizing in the patient's oral cavity. So it is very a simple commander system. We can attach multiple flashes, we can have channels created for them. Each and every flash we attach with this commander will be syncing at the same time, and when we click it has to sync with the click, and that's why this commander is there. So commander, if not there inside the camera and only two flashes are there, we cannot wirelessly connect them to each other, but we cannot sync them with the click. So what is the main role here? As we click, the commander should give a command to both the flashes that they have to fire at the particular power which I had set. So my ratio of the power I have to already preset. I have to again preset for my mode of TTL, and then I have to have the sync in between all the three, so that when I click it has to fire the flash. So it is very fraction of a second. I have told I'm working at 1 by 125 of a seconds. So it should be very much in sync, so that if it is not in sync, the image either might be very much blurred, or the image might be having a lots of lights inside. So it should be having a sync in between all of the three, because it's a wireless system. It's If it's a wired system, then it is an easy thing for us, because if it's a wired system, then everything is definitely going to be in sync. Now I am giving you three slides. These slides are very much important. I have explained about the extraoral settings, profiles, intraoral, right, left, whatever things which are going to be clicked intraorally and extraorally. Now just think about flash system with all these kind of settings. I'll just tell you why this intraoral setup is important inside the camera settings. There is a menu button. When you press, we have f-stop number, we have ISO, and we have shutter speed. I have already spoken about this, but there are few more settings inside. I'll just tell in brief about them, because in the processing of the images in the on the fourth day we will be explaining about these settings, how we're going to work about this. We have autofocus system set AFS. AFS means the camera itself is having an autofocusing system. We are not going to change that. We are not going to change the center weighted styling of the images, which means that in the center, whenever we are clicking in the center, in that center, the whole of the image and the whole of the details are going to be shared. So I'm not going to have a change in the center weighted. I'm not going to change the settings of the saving of the image. There are two types of settings. One is a JPEG and one is a RAW. RAW is the file, that is the file which can be manipulated in any form. We can change the color, we can change the lightning, we can change the exposure settings. We'll talk about on the fourth day about the different kinds of processing of the images. So raw image has to be there along with JPG. JPG is very important format, because this format can be shared directly on the screens, big screens, whenever you click. If you are having a Wi-Fi build, which I had given you the mention about the cameras yesterday, they're all Wi-Fi built cameras. You can directly click and you can share the image directly by through Wi-Fi on your big screens. So that is a very important factor for us, because JPG is a universal format. Raw format requires different kinds of softwares for them to be manipulated inside. You cannot just open your raw image inside any kind of regular going softwares. Then we have a flash setting. Flash setting is WB, and it is set on auto with a Kelvin. This is a Kelvin temperature of 5560. Now this is to be standardized by use of auto mode of the flash system. Now why this is important, we'll just discuss this on the fourth day, because it has got lots and lots of importance when we take intraoral photographs and we share these photographs with the lab person, because we need to have the white balance. This is called as WB, white balance, to be perfectly mentioned, so that the shade doesn't change when we give it to the lab person, and and when he gets the shade properly, then only he can give us good prosthesis back, in whether it be implants, whether it be normal veneers or normal aesthetic crown work, or whether it be any kind of prosthesis for that matter. Okay, so after this we are having two more versions of color balance. This is called as vivid, or this is called as sRGB. RGB stands for standardized red, green, and blue. We are going to work for this system only. We are having a setting inside the camera for sRGB. I'll explain you when we talk about different kinds of settings which we are going to work when we are processing the image. And vivid is the kind of styling of the, just like we use filters in Snapchat. We have very much a good amount of filters in Snapchat which can change your color, we can change your profile, we can change anything in Snapchat. There's source filter. In that, vivid is such kind of a filter inside the DSLR where the light and the colors of the images are at the maximum uh, good saturation in the sense that the color reproduction of the image which has been inside the oral cavity and which has been clicked by the camera, it is the same. So vivid always be used whenever we are having the filter to be used in the intraoral setup. Again, closed closed mouth setup when we are not going intraorally. This was intraoral. Closed setup in the sense when we are having an artistic lips, when we are having aesthetic reconstruction of the anteriors, we are having f stop number f114. These three settings, only the f number is going to change, but 1 by 125 and ISO both are going to remain the same. Center weighted styling, again all the things will be remaining same apart from the change in the f-stop number. So it is very easy for us just to manipulate with the f-stop number and we'll get a good lighting system for closed. Then we are having portraits. Now I just explained about this. Can you see the shadow on this side? We are having a shadow on this side, we are having a very bright light. So this means that there is light on this side and very low power fill light is there. So the key light is having the light over here, and the fill light will be having a very low power and it is filling a very small amount. So can you see the borders, but they are not properly illuminated. So this is a style of portrait setup. The f number is changing to 9 to 13. So this is for just for us to understand where the changes are from f22 for intraoral, where we want everything to be in focus, from f14 to f9 to 13, which is for the portrait setup. Now, why we yesterday explained about two flash system. There was one flash system called as the ring flash and one flash system which is called as the twin flash system. Just see two images of here. The upper image is having something called as circle here. Can you see small circle? These are all about the lights which are given by the ring flashlight. Very much loss of details. There are no details as such, but in this case you'll have two flash system. Can you see one flashlight here, one flashlight is hitting in this area. We can have a aesthetic kind of a photography in the anteriors by use of a twin flash. I do not recommend it for the posteriors because the light doesn't go and hit inside the posteriors because it is very difficult for us to set up a mirror over there and then we can have a good image, because twin flash system is again a very bulky system. So for daily use, yesterday I told, for daily use you can definitely utilize the ring flash system. Now this is a studio light setup. Can you see the details? There are good details about the tooth which has been mentioned. The tooth, the structure over the tooth, even the pericymata over the tooth, the lips, the structure. So this is all about the studio setup. This is a twin light system only for the studios. We will have a very beautiful image, very sharp image whenever you are using. So as we go on from ring to twin to a studio setup, the studio setup gives you a good quality image again, but the expenses of the imaging and the imaging techniques and the camera system, the flash system is high when you are talking about the studio lights. So inside a clinic we can daily use a ring flash just to record. See, this is our purpose is to record first, not for artistic photography. Artistic is just a part of your own personal choice, because if you want to carry out artistic photography, I carry out macro photography, but I cannot carry the studio lights each and every time. So that's why I prefer a twin light system to be always going on handy. Now see, I was talking about the called as the magnification ratio. Again, you can check. So the magnification ratio as I go on, for it is the best part of the system of the camera where we use macro lens. Macro lens can have different magnification, 1:1, 1:2, 1:10. So we can have magnification ratio and we can have good focusing. This is F number. F number has changed to F22. See, can you see every tooth which has been there inside the oral cavity is been seen. So we can manipulate with the magnification ratio whenever you are using a macro lens. But it is not possible with any kind of different lens with these kinds of details. So better for any one person who is having enthusiasm for dental art photography, you can definitely buy a macro lens. Now, yeah, this was again explained because we need to keep your shutter somewhere and you need to focus lock somewhere. Because if I focus on this area, I will have an image of both the tooth also sharp, and if I focus something over in between, I will have this much area only. So can you see this image? If I would have focused here, my canine and my premolars would have also been in inside the focus area. I can increase the f number, but if I have kept my shutter and the focus here, see, I can just see hardly of the canine, which is again blurred only, but I can see 1 2 3 4 4 to be in very good focus. Rest of the things are a slight blur. So I want to check for the f-stop number or the aperture size, and I also want to check for where my focus point is. This is very important whenever you click. So be keep in mind about the f number. When see dental photography is very simple. You just need to manipulate with the f number. Rest of the settings which I had already explained, they're all the same, but focusing on which point you have to focus, that is much more important. To frame the image, then click the image, because if you don't frame it properly, then again you will get some people keep their gloves here, some people keep their cheek retractors here. You see your cheek retractors here is not at all advisable, because they are not going to be accepted anywhere, whether it be publications, whether it be any kinds of system in the social media, because we need to give the patient also an understanding what the work is going on. Now see, this is the one image which I had already explained about, but the flash power system can bring drastic changes. Can you see the flash power system, which is to be at 0, but the flash system at n+4. So this is the flash system which is going to fill with whole of the light. I don't want this also and I don't want this also, which is having a low light, which is having a bright light. I want something in between these two. So whenever we are talking about flash power system, I don't want something to be underexposed. This is called as an underexposed image, and something called as overexposure image. I want something in between. So that's why the exposure triangle has to be learned, because DSLR is all about, not about auto. Nobody has to click in auto. It is all about manual settings, which I had already explained. It's very easy for us to understand. Just get a hold of an DSLR so that it is easy for you also to know where the buttons are and where these flashes settings are going to be changed. Now last, I'm going this photo can be clicked. I will share you the details of with an image of this. This is the consent for dental photography. Everyone, which is the person or the clinician who is taking photograph of a person for dental record system, dental research, for inclusion in lectures or seminars, or for marketing of their printed material, patient education, they are supposed to have consent for dental photography from the patient itself, and this has to be taken, and signature has to be maintained with the date of the patients. So this is to be given to all. I'll just forward this into the group, and so that it can be circulated. So this makes us to the end of today's session for the flash power systems. And tomorrow we are going to have something very much interesting. People nowadays are talking more about this, something called as mobile photography for dental and macro, because it's the one of the most handiest thing which is to be carried out by each and every individual. Everyone has a good nowadays good camera system inside the mobiles, but I'll tell you what can be done with mobile photography and what are the limitations for it, how we will enjoy mobile photography, And if there are any macro things related to mobile photography, we'll discuss that in details tomorrow. So please do come and join again. I'll be happy to share my knowledge with you all. Thank you, Research Circle, again.
Thank you so much, sir, for this very nice and informative session, sir.
Thank you very
If
much, Preeti.
If anyone has any question, you can ask. I think no one has any questions, sir.
Okay, fine. Not an issue.
Thank you so much, all the participants, for your active participation. Let me inform to all that this complete session will be available on our Research Circle YouTube channel. So if you want to watch it again or want to share it to somebody, so please do visit the Research Circle YouTube channel. And tomorrow is the third day of our workshop, which is titled as Mobile Photography on 3 p.m. So tomorrow we will meet you same time. Thanks. And last but not the least, thank you, Dr. Hiroj Bagre, sir, for taking out time for session. With your permission, I would like to end today's session here, sir.
Thank you very much, Preeti. Hope so. We'll join tomorrow morning, tomorrow afternoon, 3 o'clock.